Yeah. Yeah. Yeah.
Okay.
Judy, can you please start again? Yeah, sorry.
Yes, okay. So good morning, good afternoon, good evening, everyone. I am Judy Lewis. I'm the board president of Women in Health Together for the Future, based in Cape Town, South Africa, at the University of the Western Cape. We began as an interest group in 1991 in Nigeria, and Nigat and I and Amani Rafat are three of the original founders of the organization. We're really happy to have you here today. We want you to know a little bit more about our work. We have provided seed grants to over 54 organizations to start small projects to improve women's health. We have this webinar series, which we hope you will join us in every month. And we also are involved as the Women's Health Community of Practice, which we invite you to join. For more information, I have put the link to our website in the chat box, and we are really happy to have you all with us today. So I'm going to turn the program over to Nagat Huda from Pakistan, who will introduce our speaker, Tony Clays. And we're looking forward to a lively and informative presentation and discussion. Thank you.
Thank you, Judy, so much. Thank you. I have the pleasure, I'm Professor Nigatota, and I have the pleasure of introducing Tony Claes. And he is no stranger to us, to WHDF, but I think it's important that he wears several hats. And, so I'd like to start off with that he's the coordinator of Vibes University of Applied Sciences Life Lab at Belgium. And he's a researcher at the Center of Expertise for Care Innovation, and that is also at Vibes University of Applied Sciences in Belgium. And he is the project coordinator for Blur Yos, Kenya, and the project member for Blur Yos, South Africa. And I tried to search for Blur Yos, and I found out it's a funding agency, and I think Tony can correct me that. And it's just that it partners with with educational institution, and it provides grants and have relationship to improve their health and education, and intersectoral collaboration as well in the community. So he's also we know him because of his maybe more with the tough towards unity for health. He's the member, he represents Europe on the regional board of TAF. And he is currently, he's enrolled or pursuing his PhD at Maastricht University in health professions education. And he's very passionate about transforming health professions education, training of doctors so that they could not work and train in silos, but work together as interprofessional education, interprofessional collaboration, intersectoral collaboration. So, Tony, I hand over to you. I think I'm not sure if I did justice to your introduction. You can add more to yours. Okay. Thank you, Tony. And I think we'll have a discussion at the end after Tony's presentation. And I look forward to your questions. Thank you, Tony. Take over, please.
Thank you, Niga. Thank you, Judy. Thank you, everyone, for being here. Thank you for the wonderful introduction. I was not aware of myself in that way, but it's true, Nihat. We are not strangers. We know each other for a long time now, and I wear several hats. Yeah, and one of my hats I'm wearing today is as a professor, as an educator at the Vivas University of Applied Sciences in Belgium. And from that angle, I want to share some experience, some kind of a story with you and discuss on how education or professor can improve maternal and children's health. Okay? So I'm going to share my presentation if that is okay for you.
Please. Please.
Okay. Okay, can you see my presentation?
Yes, yes, we see.
Yes, yes, we can.
Okay, everybody disappeared. So I'm going to start. So welcome
UTC मतलब क्या होता है UTC?
welcome
UTC
to the session on education
Coordinated Universal Time.
for improving maternal and children's health. Yeah.
Yeah.
So that's me. I'm very happy
पहले
to meet.
Greenwich time होता था ना median time GMT.
Okay, maybe
UCT हो
somebody
गया
can use
Coordinated Universal Time.
Sorry. Can everybody please mute yourself so that the presenter can start this presentation? Please mute. Thank you. Please, sorry, Tony.
No, it's okay. It's okay. No problem. Okay, so I'm Tony. I'm the coordinator of Viva's Life Lab, and I think that's the most important you have to remember for today, because I'm here because I have experience with the Viva's Life Lab, and the Viva's Life Lab is actually an intervention in education, and it's professional intervention in which we would like to send students into the communities to have a learning experience that is from the angle of a community engagement. Yeah, and that is a story I want to show you today. I'm also a researcher, work with TAF, and I have some involvements in the Vlerios projects, one in Kenya and one in South Africa. And Vlerios is a funding agency in Belgium that actually would like wants to support educational organizations all over the world, to improve education. Yeah, but also one of the important angles, or one of the important goals of that funding agency, is that you immerse yourself with education in the field, in practice, in the community. Okay. So the first thing I want to do is I want to share a movie, and the movie was created by two students of mine, Bram and Brecht. Yeah, and in the previous project of Vlerios, we worked in South Africa, and we worked with community healthcare workers. And actually, I asked community healthcare workers, can you explain me what you need more in your fields or in the community about education? And they actually wrote it down, during a focus group, and they really down in their native language, which I could not understand. So we got it translated. All the participants of that focus group, all those community healthcare workers, said to me that they really need to be trained on maternal and child health. So just to show you that really their story and not my story, I will show you this short video.
Nga dzina ndipfi Mukandangalo Chilonga Mlenje ndo vhuya na founeliwa vhukati ha vhusiku u tshi khou vhidzeliwa uri ndi ḓe ndi founele ambulance. Heḽo ḓuvha ambulance yo lenga u swika vha ḓa nga matsheloni vho wana ṅwana o lovhela thumbuni. Zwa mbavha vhukuma. Ndi khou humbela u pfumbudziwa nga u bebisa vhaimana.
Ndi nṋe Thandavha Lufuno ndo swika kha client ya mufumakadzi o vhifha muvhilini, mathina u khou ṱoḓa u beba. Ndi tshi dzhena a mbo ḓivha a khou phusha a tshi khou beba ṅwana, ndavha ndi sa ḓivhi uri ndi ite mini. A thina nḓivho, ndi khou humbela thuso, ndi khou humbela u funziwa nga ha first aid ya u bebisa, kana ndo wana mme a tshi khou beba ṅwana uri ndi mu thusisa hani.
A community health worker is a voluntary, a volunteer in the community who is responsible for caring for people with chronic conditions at home, caring for the elderly, as well as the orphans in their own homes. They are very important, especially in our context where the healthcare services are always overcrowded, and where people who are suffering from chronic conditions are discharged daily from the hospitals, and they are discharged to be taken care of by the community health care workers in the community at their own homes. We also call them foot soldiers of healthcare.
Okay, nedzina langa Tibudrimamba Nandi Shomatando home based care as a community health workers. Rivana va manese sibadela clinic gai hote une ra va ri hone manese va kunu ruma rine ra twa ro va ri ko ita support nda unga va community health workers ndi yone nḓila ya u vhuisa vhalwadze nga ngomu kiliniki. Community health workers ndi vhone vhane vha vha na uri vha kone u ḓivha uri mulwadze mukene. You do support to drink a medication and don't lose your hope for medication.
Ndi zwone rine riko zwine vha khou zwi amba vha muthu ti ni ri khou pfha uri ndi zwa ndeme ngori tshiṅwe tshifhinga wa vha u na mulwadze hafhanoni kha community, mulwadze tshiṅwe tshifhinga vha tshi swika vhaḽa vhathu vha ambulense vha wana o lovha hu rine ro yo ḽa muthu a tshi kha ḓi tshila. Tshiṅwe tshifhinga dzi ambulense dzi a ri a dzi founela dzi a ḓa hafhanoni, ri tshi founela dziḽa dzi ambulense dzi khou ḓo hwala vhathu dza primela hafhanoni nthu badani ngori mini muthu a ri na kiḽiniki a ri na sibadela tsini, zwine zwi sia zwi sa khou tou vha zwavhuḓi kha community. Zwi amba uri community i na vhushai wo sa vha na sibadela kana kiḽiniki.
So that was the story I wanted to share with you. And my PhD is on interprofessional education, collaboration, and primary care. So in the field, in the communities. I really believe that through collaboration, interprofessional collaboration, we can support people in that community. And as you saw in the movie, they testified that women needed help when they are pregnant, because help is often too late, because they are out of the community, or ambulances came too late and people were dying. Yeah. So we decided to submit a new project, because I really believe in projects with students in the community, with the real people. And it was called Intersectoral Synergy for Maternal and Child Health. Yeah, a collaborative endeavor across Kenyan universities. So in that project, we will work. Yeah, project started last year. During this project, we will work with different Kenyan universities to improve maternal and child health through education. Yeah, education from students, but also education from professors working at the Kenyan universities and even in the Belgium universities, and education from the people in the field, like the community healthcare workers or the community health providers, as they call them in Kenya today. Yeah, but also education for mothers, for women, for children, and even families like fathers or parents of the women who are pregnant. Yeah. So just let me give you an idea of what we see as the problem. Today, we have a high maternal and child mortality in Kenya. That's a really big problem. I was shocked when I visited a community clinic where I saw that every month one mother died of pre-eclampsia, yeah, which can be avoided, yeah, by a good follow-up of the mothers. But you know, it's not different in your country. I think even in Belgium, where I live, we have a lack of professionals in the community. So how can we solve that? Yeah? So the main causes for the problem is limited access to healthcare, yeah, and limited access means not enough professionals in the in the field or in the community, and a lack of knowledge on maternal and child health. Yeah. So one of the things we also want to cope with during the project is evidence-based working, because what is good and what is not good, what is good, but what is also better when it comes to uh, mother and child health. Okay. So the solution is that we really collaborate with the four Kenyan universities. And you will ask me why four Kenyan universities? Because every university has a very specific angle in the project, and will train students in their very specific departments on mother and child health to improve the living conditions for women and mothers in Kenya. Yeah, but also will train students from the other universities from their very specific expertise. So they will share expertise across Kenyan universities, which is quite unique. I have never seen such a big project at that scale in Kenya, but even in other countries. Yeah. Our solution is to focus on education. As I already told you, education can be the catalyst, is the power. Yeah? Education can educate people, like the teachers, the students, but also the community, but also improve access to care for that people in the community. Yeah. One of the main goals is also training community health providers, because my experience is that community health providers or community health practitioners, people in the communities, in the rural areas, have a very important role. Yeah? They always told me, Tony, the doctor is coming, or Tony, the nurse is coming. And when I was there, I don't see a lot of doctors or nurses. Yeah? So most of the time, community healthcare providers are alone. So my goal is we need to train. My solution better is that we need to train students together with the healthcare practitioners or the health community healthcare providers, because then they learn to know each other and they really learn to value each other. Because from what I have seen is that there's a little trust between professionals and community health providers, although community health providers do a lot of the work, maybe most of the work, yeah, and have a very important role. Yeah. So future professionals have to trust the community healthcare providers or practitioners to improve health of women in Kenya. So our goal is to reduce the inequalities, to health and strengthen local knowledge and healthcare, the local knowledge and healthcare in very specific regions, but also across Kenya and maybe also across the world, because I think this project can be a good example on how we can improve women's health, through education from the view of with the support from um, universities or universities of applied sciences. Okay. So one of our goals is to make a sustainable improvement of maternal and child health. We really would like to change the world, as I can may say. And we would like to strengthen maternal and child health in Kenya through the interprofessional collaboration, with the universities, but also with the community health providers, because everybody has his or her expertise and can share something which is of value, with the others, with the other stakeholders in our community of practice. Of course, we would like to share expertise or train students all together, and also the local communities are involved. Every university has assigned one or two CBOs, NGOs, which are focusing in the very specific region on mother and child health. So we can find out how we can support those women and children in that area and even across Kenya and across. Okay. Why through educations? We know education gives a better knowledge, which leads to better skills, and better skills are needed for a better care. We're also convinced that education is a way to connect the different universities and teachers involved. Because teachers have a very important role for students. They teach the students and they are a role model for the students. So teachers have to be updated, but also have to know about what are good practices, what is evidence-based practice to that very specific area to teach the students. And only when teachers are ready, students can get trained in a proper way. So that's why we take into account also the teachers. But also we take into account the community healthcare providers, and also the families. Because when we wrote the project, I was in Kenya, and we had a very interesting quote, and the quote was, "You are not pregnant alone," with which we wanted to say that if you're pregnant as a woman, you're not pregnant alone. You also have a father, but you also have a lovely and surrounding family that supports you. So we take the families with us. The idea of you're given a lot of support from your family. So that's why we cannot leave the families out of this. So we have different project partners. We have the University of Eldoret, and the various specific expertise of the University of Eldoret is nutrition, public health, education, and agriculture. And as you see, I think when you want to talk about interprofessional education, you have to preach what you teach. So we preach about interprofessional education, and that's why every team at the project partners has an interprofessional team. In this case, it's a nutritionist and a public health scientist, and an educator, and an expert about agriculture. Another university is the Alupi University, and they have more expertise in public health and behavioral sciences. What you see is that very specific expertise adds value to the already existing expertise of the previous university, which is quite important in this project, because you just bring more expertise in and more views, which is very interesting and beneficial for the collaboration if you want to solve um, mother and child health and the conditions of women living over there in Kenya, in most of the time very specific rural areas. Yeah. Then we also have Jomo Kenyatta, yeah, and there we see agriculture, but also technology. We are 2025, and you cannot leave technology out of an approach if you want to improve health for women in Kenya. And then we also have the Masino University, which has expertise in health, gender and health, gender and development, but also in public. Yeah. So I think all those universities are complementary, supplementary in any way, yeah, and it is a very strong team that works in this project on mother and child. Okay. I think this project is a good example for good practice. I really believe that today a university or a university college is not only an institution that teaches knowledge, but also teaches a way of life, yeah, and should transform into community-oriented campuses or community-oriented universities. Yeah, so that's why community service learning is very important in our approach. Yeah, students will learn with the community, so they will learn with the people, real problems. Yeah, real community healthcare workers. Yeah, and they will do it in that community. Yeah. If you're looking to some kind of level of difficulty in learning, yeah, learning in real, authentic settings like the community is very beneficial for students, yeah, and you will train them with real life experience, yeah, really hands-on experience, which is very, very important. Okay, so also the interprofessional education approach, we have students from different departments. As I told you, the expertise of the different universities is supplementary and complementary. Yeah, we have students from health, we have students from agriculture, ICT, education, public health, and so on. And it is a very innovative project because we will bring all those students together. Yeah, and one of the goals is that we develop a course on evidence-based practice, which is not always so easy to teach. Yeah, but actually, evidence-based practice is a common course. Yeah, that is important for every student. Yeah, if you have to look up a scientific article or a guideline, yeah, it's the same for health or for students from agriculture. So students will learn with, and about each other, as said and demanded by the WHO, to improve mother and child health and improve the situation for women all over the world, and to be more specific in this case, Kenya. Okay. Do we think we have impact? Yes, we are convinced we have impact with our project, and the project that education can have impact on at 3 different levels. So first, we have impact for students and teachers. We really train them in real life learning experiences. Yeah, it's there is no simulation. It's real life action. Yeah, in the community. Yeah, and we really learn them to collaborate into profession, to value each other, to know what every profession is doing, and to train them out of the silos, as Nigat already mentioned, that we cannot do any longer. Yeah, and we will develop critical thinking. Is the way we cope with a problem or deal with the problem, is that a good solution when we look into literature, when we look into evidence? That's the level for the students and the teachers. And it's the same for teachers as for students. Yeah, it's even for teachers very difficult to work on evidence-based practice, because every day we have new publications, new insights. So that's why teachers are as important as students. We also have impact on the level of the community health practitioner and a professional, because through the collaboration, yeah, we invite them to university and we go with university into the community where they work. We provide them new knowledge and practical skills on mother and child health, how we can improve the situation of women living in that rural community. Yeah, and we will create a stronger link with universities. Yeah, which brings us to back to yeah. Do we really know what is needed in that community for those women? Yeah. And what evidence do we need for that? Yeah. So it even facilitates research. Yeah. And it facilitates also working across sectors, because in Kenya it's not common to work with all professionals together. Yeah, as community healthcare professionals, most of the time are not seen as real professionals. They get some kind of training, but they don't have the traditional training of a professional. Yeah? So I think if we want to improve the situation for women in Kenya and even in other parts of the world, yeah, we should leave that kind of thinking behind us and think in a way that everybody who is working in the community or around a person or a patient is important to involve in that collaboration. Yeah. So for the community, we have impact that we improve access and to care and quality of care, because if we go with students in that community and we work with community healthcare workers, we can do something about the lack of professionals in the field. Yeah. And I did a study for my PhD, and I can already reveal you that it is possible, yeah, to support people in the community with interventions, yeah, to improve the quality of life and improve the access to care in that community. Yeah. And then, of course, we have impact on healthier mothers and healthier children in that community. And we have impact on the sustainability development of that community. Okay, so we can say that it's very important that education is a key driver for maternal and child health, and as is a key driver for women all over the world, yeah, to improve their situation, because nowadays something needs to happen to support those women, because a lot of women do not receive the care they really need. Yeah. So, and that education will improve knowledge of stakeholders I have already discussed, the skills of those people, and will have an improved care. Okay. If you want to know more, because I see time is going very fast, there is a link in this PowerPoint. It is testimonial, yeah, and it's one of the midwives, yeah, that is doing a scan from a pregnant woman, yeah, and it's also a testimonial from a girl who gave birth to her baby on an island in Kenya, which is Mafangano, and Mafangano is one of the CBOs that is joining us in the project to improve living conditions for women over there. So I'm convinced this project demonstrates that education, yeah, when connected to real community needs, creates sustainable health impact. It's a win-win for students, professionals, and the community. Any questions? If you're okay, I'm going to stop sharing. At least I can see you now, because
Thank you so much, Tony, for elaborating on your project that you've done in Kenya. And it's very interesting that 4 universities were involved in it and all had a different, aspect. And of course, it was the health of the community that mattered the most, and how you've done these projects. Well, can I ask for questions? Then I can have my comments on it later on.
Yeah.
Anybody with question, please?
Yeah, I have a question.
Yeah. Kamini, please go ahead.
Yeah, Tony, I just wanted to ask you, when we put the students in community, right?
Yes.
How the project is like time-based, whether it's 6 months or 1 year, I don't know. So what are the ethical issues which emerge, and also the dependency of the community on the students? Does it continue? So when the project ends, what happens to the community there?
Okay, that's a good question, Kamini, because that's a question I got all the time.
Hmm.
I really believe that if you are doing community-oriented project, you cannot start a project that ends in 6 months.
Hmm.
Yeah. So you really have to work on sustainability when you are focusing on this kind of project with your university. Yeah. Um, so ethical issues, I don't, you can see a lot of issues or you cannot see issues, because if you really believe in it, you really have to go for it. Yeah. If you only look to the ethical issues, you will only see problems. Yeah. What I see from my context is that when we are launching some kind of project as this, my people, can I say it like that, see more problems. Yeah. And when I, for example, go abroad, people are more daring to do this kind of projects. Yeah. And I can really appreciate that approach, because if you really want to change something, you should start acting. And you cannot always talk about it. Yeah. So just act, don't look at the ethical.
Yeah, I totally agree with that, Tony. But my question is, when you talk about sustainability with the university,
Yes.
how does it work? It's work, this
Okay.
collaboration. How does it work?
So how does it work in Belgium? We put it in an internship. Yeah, so we really agreed that everybody should do interprofessional education. We really agreed that everybody should do a project in the community and primary care. So we give them credit. It's in the curriculum of students. Yeah, and that makes it also sustainable. Yeah, so we know that every semester, first, the second semester of every academic year, students will go to that community and work with that community year after year. So it really works. We are now doing it for 7 years already. Yeah.
Oh, great. Yeah, that's what I wanted to know.
Yes.
Yeah.
So, and what I see,
Yeah.
it works. Yeah.
Okay.
And yeah, but
Okay.
if you don't put it in the curriculum of students, it will disappear. That's for sure.
Yeah.
Thank you, Tony. I
Thank
think,
you.
Kamaini, are you satisfied or not?
Yes, I
Okay,
am. Yes, I
thank you. I
am.
see Amani's hand for a long time.
Yes.
Amani, could you please?
Yes. Thank you, Tony. I'm a big activist of community-based education. I spent the first 10 years of my career as coordinator of community-based education, and I took my PhD dissertation on planning community-based educational curriculum. However, there are barriers and problems. I agree with you that it should be in the curriculum. It was in my school in Suez Canal University. However, after the However, after the leadership changes, the community-based activities diminished by changes in the curriculum, and it is now it is not there at all. Maybe some minor activities, but not as a part of the main curriculum. So I agree with you. So I would like to know your input about how do you plan to, because interprofessional education and community-based education are great to work in. However, there are barriers and difficulties and resistance from other faculty working with you. So did you face some, or are you expecting some, and what are your plans for tackling them?
Okay, my plan is never give up. Hani.
Yes.
That's a good plan, eh? Yeah, but I agree. Yeah, when leadership changes, it's always important to to convince people that interprofessional education and community-oriented education is important. Yeah, it's a struggle always again, but I'm very lucky. Luckily, my new deans all really strongly believe in the approach. Yeah, so I I do not agree that some people stop having that kind of education. Yeah, because if you look to the WHO, they say that primary care is becoming more and more important. Yeah, we are sending
I
people to
agree.
hospitals.
Yeah,
Yeah,
I agree with you 100%. Yeah, I believe in that personally, and I thought a lot about that.
yeah.
However, when you are starting to feel that you are alone and the resistance is stronger, um, maybe you will be more lucky than me. Okay. So I wish you good luck.
Thank you, thank you. I always also go to the community and ask their
Yeah.
support. Yeah, and I was never refused support in the community. So then I come back to the university and I said, you know, those people want to work with us.
Yeah.
Yeah, and actually, yeah, they're a little bit forced, as you say, because we have a question from the field. Yeah, but
Yeah.
I think we need a mind shift. We need people for hospitals. Yeah, but we cannot focus on training only professionals for hospitals because more and
Yeah.
more people will work in primary care.
Absolutely. Absolutely. I agree with you. Thank you, Tony. Thank you.
Okay, thank you. I saw a young. I'll come back to you, Dr. Bengal. There was a young woman. I
Yeah,
don't know.
Mukta, I think. Yeah.
Apta, I would like her question before I go back to you and Dr. Bengal. Mukta, is she there around?
Yeah. Thank you, madam. Uh,
Please.
a very good talk by Tony. And I just, my question is basically an extension of the question put by Kamaini. Like we have talked about ethical, but as we know, in this community based education, students are going to community and they are not yet having license to treat the patient. So how will you go about for the cases of wrong diagnosis or some wrong treatment, because somewhere this is a vicarious liability may issues of vicarious liability will be there. So those litigations or those ethical legal, how will we tackle those things?
Yeah, okay, Mukta, that's a good question. You know, when we start community-oriented projects, yeah, we really want to find out what the people really need. Yeah, and most of the time, this project I was talking about in Kenya is about education. Yeah, so actually we are not talking about wrong diagnosis. Yeah, we are talking about uh, evidence practice. Yeah, what evidence is available and should be used by professionals or students when they come into communities. And now our focus is the community, yeah, and maternal and child health. But you know, they can apply that knowledge also, for example, when they're working on an emergency ward in a hospital, yeah, because it's where to find the good examples or the good practices. Yeah? When we do community work, yeah, we always start with some kind of needs assessment. What do you really need? Yeah, and then we look for guidance in very specific topics. I will not say anything about a diagnosis because myself, I'm not a doctor. So we try to involve with doctors. Yeah. In my project in Belgium, we avoided that a little bit because a lot of people in Belgium have already a doctor and have a nurse and have a physiotherapist. Yeah. So we use the ICF scheme, yeah, the International Classification of Function scheme. Yeah. And if you look to that scheme, you can look to the bottom part of the scheme. Yeah. And then you're focusing on the context. Yeah. The context in which people are living. Yeah. And you're not focusing on the disease. Yeah. So from that angle, we can always support people because it's about context, healthy living conditions, yeah, social deprivation. People are staying inside and can do not have contact with with the community. So in that way, we avoided to have a conflict with professionals, because I don't want to have the discussion with the doctor about the diabetes. Yeah. But I am convinced that my students, we followed 100 elderly approximately. I will publish it in a few weeks. Yeah. 100 elderly in the community, guided by different, each elderly guided by an interprofessional team of students. Yeah. And we were able to provide 500 interventions, yeah, per elderly, yeah, which had to do with the living conditions and the context of the people living in, or the elderly living in the community. Yeah. So, we are not going to change the community, but we can do a lot for people, like people who were not able to say goodbye to a family that died, for example. Yeah. And I think it is important that also students learn to see that, because one of my studies said that when you're doing community work, yeah, and interprofessional teams, and they're really involved with the elderly, or with the people from the community, they really learn to see why some things are valuable for them. They learn to understand why people made choices, or what the choices are from people, because I always look to a patient with the glass from a professional. Yeah. So I always see problems. But my patients don't want to solve all those problems. Yeah. So patients had to be involved in what problems students will solve. Yeah. And then those patients will explain why it is important for them. Yeah, I always give the example. If you're looking at me, yeah, you will say, "Oh, you told me you have to lose weight." Yeah, eh, okay, that's from the angle of a dietitian, because she said, "Oh, he's too heavy. He has to lose weight." But maybe I say I don't want to lose weight. I want to do something about my loneliness, for example. Yeah? And then when it really starts happening, then when you can make the change with your students, because students can look up for solutions to work on the loneliness, for example. Yeah.
Yes. Okay. Thank you. Mukta, are you satisfied?
Yeah, miss. Yeah, thank
Right.
you. Thank you
Thank
so
you so
much.
much. Dr. Bengal, I think I see your hand up, and Sureka is also, Judy. Dr.
Yeah,
Bengal, can we have a
yeah.
quick question from you? Quick question.
It's not a question, but it's a comment. Uh, I would like to share what is happening about this in India. In many universities and institutions since last 50 years, they have adopted this family adoption program in undergraduate course for our medical students, which has a mutual benefit. Students are also learning, and the family and the community is also being benefited. Now, students are taken in a group under supervision by their teacher, where the students learn how to take history at the village level or in their houses. The students examine these families which are allotted to them. They take sickness history, they see the living conditions of these people. They see what they eat. They ask for dietary history and health and hygiene. So all this is a learning experience for the students from the year, from the first semester itself. They are allotted these families, and almost for 5 years, these students are regularly every month going to this. Now, understanding the importance of this particular program, students going into the community, our government, that is Government of India and the National Medical Council, has made it compulsory, mandatory for all the medical colleges to adopt this program, that is a family adoption program or a village adoption program, and students are really benefiting from them. So this is what is happening in India, and definitely, as Tony said, there are many advantages for the community, for the students, and it's a good initiative. uh, when these students are referring these women or the people to the hospital, these students are going with them in different outpatient departments, where if they are admitted, students are going and meeting them. So it's good for the community also that someone is there to be with them who they really know as they are regularly visiting their families. So in India, it's happening, and I think it's a good initiative. Thank you very much.
Thank you. Thank you, Dr. Bengal, for sharing this. Surekha, where are you? Surekha, can you?
Yeah,
Do you have?
thank you.
Yeah, yeah. You want a question? You have a question?
Mm. Just a minute. I think I have two devices, so there may be some noise. I was trying to mute it. Is it okay now?
Yes.
Am I audible?
Yes.
So I just wanted to appreciate, Tony, the whole initiative, and particularly the work you're doing in Kenya and other four countries I could see where the whole project is being done. And definitely, as you rightly said, there are a lot of advantages when we have the student, the service line learning type of, approach to healthcare, and especially women's healthcare. And when you're talking of the elderly and how you take care of, I like that example very much when you said, I don't want to lose weight, but can you do something about my loneliness? We have, as a doctor, different perspective. We just focus on the disease, but what about the various other social factors? So I think that's very important, the way you stressed out that it's not only about medical medications or drugs. There are so many aspects of wellness that has to be addressed. And one question I would just like to ask about the community health workers which you recruited. So what is the process about for recruiting these community health workers in your project? How do you go about it, and are there any barriers or challenges when you do this?
So for our project, yeah, we asked the four Kenyan universities involved with which NGOs or CBOs do you work? Yeah, and are those CBOs willing to work with us? Yeah, so if they were willing, and we have for every university we have approximately two NGOs or two CBOs very specific on women and children health. Yeah. We offer them trainings, yeah, because that's, if you look to the movie, that was really the question from the community healthcare workers. So, and although in Kenya there is some kind of training on maternal and child health, yeah, for example, in South Africa that was not the case, yeah, and I know there are a lot of community healthcare workers working in the community who do not or did not receive any kind of training, but they have to solve the problems. Yeah. So, for example, what I've seen is I talked about the trust, yeah, and that's the only barrier I see, yeah, is that they are not often trusted very well by the professionals. Because when I asked my students in nursing over there, why don't you trust them? They said they are not really trained. Yeah? And I said, what is really trained? Yeah, because you know, if you if you if you do first emergency aid, yeah, you also do your best. Yeah, and is a small course a real training? Yeah, it's all in the word of training. Yeah, and although they might not be very trained, yeah, they have a lot of experience. Yeah, so I think we should build on trust. Yeah, and we have some kind of theory. It's called the social contact theory. Is that you are afraid sometimes of new things or things you don't know, but as soon as you get in touch with them, you really learn to value them, yeah, and appreciate them and understand them. Yeah? And that's actually the theory I want to apply on this. Yeah. So by bringing students together with the community healthcare workers, yeah, community healthcare workers learn, for example, not to be afraid of the professional with his or her training, which is important. Yeah, yeah. But on the other hand, yeah, students or future professionals learn to see how valuable the community healthcare workers are. Yeah. So what can be the effect of that is that what I've seen is they did not trust each other, so they did the work again, because the work that was done by the community healthcare workers was done again because it was not a professional, and only the professional believed the professional. Yeah. So what I hope to achieve with this is that they trust the community healthcare worker. And for example, if they have some kind of survey filled out, they really trust that survey and build further on that data, for example, yeah, and not start again, because that's not that's not collaboration, yeah.
Thank you. I think it's a win-win situation for everybody when we have
I
the
think
local
Judy has a
expertise
question.
and
Judy,
the
sorry.
professionals working together. Thank you.
Sureka, Judy has a question. I think Judy.
Yeah, so first of all, Tony, you could not be talking to a more committed community-based education crowd. And I think we've all had many experiences over the years trying to do something like this. So my commendations as well. I mean, 7 years of this, I think all of the points that have been made have been really appropriate. I have an actual kind of structural question about how this is set up. So your university is linked to these 4 universities in Kenya, correct?
Yes.
Okay. And do your students work with their students?
Yes, starting from next year, we are now recruiting students who want to go to Kenya. Yeah. And then we will send interprofessional teams of Viva students, yeah, to the 4 different Kenyan universities to work with their students in the community.
Okay, and will they work collaboratively with the Kenyan students?
Yes. Yes.
Okay. So far in these 7 years, it's been Kenyan students from these universities that are working in these communities. Is that right?
Yes. So
okay.
That's correct, but we will start next year.
Okay. Okay, I was just trying to understand, who's doing what in this. So what you've been doing for the last 7 years is strengthening the connections between these 4 universities and their communities and the interprofessional education of those universities, correct?
No, we will do it the next 5 years.
No, but
the project started last year. Yeah. And the 7 years I was talking about were the projects we were doing in South Africa and in Belgium.
Okay. All right. So this is something that will happen, but has not yet happened.
Yes.
Okay. All right. That's helpful. Because it seems to me then you've got many layers to deal with, right? And so you have not only the commitment of your institution, but these 4 institutions. What is the geographic area that you're covering? I mean, these are 4. I don't know I know where Eldoret is. I do not know where the other 3 are. So.
Okay, so they're a little bit across Kenya. Okay. So we are covering a lot of geographic area because, for example, I think it's Jomo Kenyatta, this CBO they are working with is 200 kilometers away from the university. And Jomo Kenyatta is in the region of Nairobi. Yeah. And then we have Kisumu University, for example, and that university is working with the CBO in Kisumu. Yeah, but also with the CBO on Mafangano Island, which is a 3 hours drive. Yeah, so actually we are working with the university, 4 universities across Kenya, and then we are working again with 2 CBO NGOs, which are not really immediately in the neighborhood of that area, of that university. So we are.
It's a very ambitious project, Tony.
Yes.
And how is it funded? Is this an EU funded project or?
No, it's funded by Vlerios, yeah, and it's called the Teams, yeah. So every year we have calls for projects from the Vlerios funding agency, and Vlerios is an agency that is willing to support education, and universities, but there are always, not always, but often there is some kind of social engagement in it, so they are funding it for 5 years now. So it's also a call if you want to do a project, for example, in your country, and you see some opportunities, you can always write me an email and we can always apply for a call. So I think the calls will be
All right, that I
important.
think that's good for the participants in this webinar to know. But I wish you well. I have many more questions, but I know how to get to you. So thank you.
Thank
Great
you.
job.
Thank you, Tony. Any other question? Any from the participants? Tony, what is the role of the government? You've talked about NGOs and you talked about universities and you talked about, but somehow when you talk about healthcare, you in one of your goals, you were talking about accessibility to healthcare. The governments, I mean, they pinch in, I mean, they have the role of funding, providing finances, salary to the healthcare providers, if there is a full structure there. So how do you negotiate, or do you have any relationship with the government in this project? I mean, or is it direct between institution and you, the funding,
Actually, the funding is between our University of Applied Sciences and the four universities. So we have invited governments in one or another way. So they are always invited. I'm leaving now on Sunday to Kenya for the first time. So I hope they will be there. And that's also a way to involve them more. And to make them more aware and to have some kind of commitment. But there's no structural collaboration within this kind of project. The focus is education. So it's between universities. But of course we don't leave them out. We have some health departments involved. But it's depending on the area in Kenya. You have different areas, and every area has its own health department.
I was also thinking, this is my last chip in, because as Judy said, we are all very committed to community-based education. I've had my experience, which was a bad experience. It didn't last. It wasn't sustainable. But however, I just want to share who are the champions, the leaders in the communities. I mean, when you leave, I mean, I think Kamini also raised that. I mean, you should, by the time, you train people, you have leaders, and you leave behind, and you are happy that I have these champions who will carry on and, work together. I mean, I think it's with the students, with the healthcare providers, midwives, or community, who, I mean,
you're right. We need the believers and the champions in this era, as I can say, because we are just launching, and as long as it is not mandatory for everyone in every curriculum, it will be a fight. But even when it is a fight, I show that it is doable and that we can achieve a lot.
As long as it trickles into the community and the community benefits it, improves their health and education. And I think that's more important rather than you show your statistics, it's more important what happens in the real life in the community. Okay. Have I missed anybody for questions? Judy, anybody else? Tony, are you exhausted? How are you feeling right
He's
now?
doing very well.
Charlie, so should I say thank you? Judy, you want to? All right, good. Thank you, Tony, for sharing your project. I loved your documentary. I think your movie was also very sensational. I mean, it was inspiring how can community health workers can make a difference. And I hope you continue your association with us and you share the progress in your project. And I hope and I want to thank the participants. And I see some very new participants in this group. And I hope you will become members of WHTF and share your experiences, maybe in the community with women's in health, with education, or So I look forward to more participation from especially the young crowds who are here today. Yes. Okay. Thank you on behalf of WHDF. Sureka, you want to add anything? From my side, it's thank you. And I had the pleasure, Tony, for today's session. And I thank you. And you made my job very easy because you did such a good job and there were so many questions. You know, when there are no questions, it becomes very tough for the moderator. Thank
I
you,
would like
Tony,
to
and
thank
keep in touch.
Tony from my
Thank you,
side as well.
Tony.
Yeah, because I've been pursuing him since last 1.5 months, and he was
Oh, no,
really
it's not a
busy.
problem.
And thank you so much, Tony. I've been after him like anything. Thank you so much, and a very beautiful experience to listen to your project, and the interaction was very good as well. So thank you, and I would request the participants who have joined, who are new to WHTF, to kindly go to our website w24f.org, and we will be glad to have you as members and work with us. Thank you so much. Thank you, Jody, for sharing the session. Thank you so much.
Thank you,
Thank
Tony.
you.
Don't despair. And we better have a collaboration for WHTF. Okay.
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 Promise.
Bye.
Okay. And if you want to
Yes.
write a project, send me an email. Okay.
Yeah.
Okay.
Okay.
Bye bye.
Bye.
Thank you so
Bye-bye.
much.
Bye-bye, Tony.
Bye-bye.
Bye. Thank you all.
Bye bye. Thank you, Nihat. Thank you,
Thank you,
Surya.
Tony. Okay.